First thing, we're gonna do the assessment of the mouth. First thing to do is inspect open and close mouth for symmetry and alignment. Open. Wearing gloves, inspect and palpate lips for color and consistency. Next is wearing gloves, inspect and palpate vocal mucosa for color and landmarks. In this procedure, use pen light and tongue depressor for retract the lips and cheeks. Lips are smooth and moist with lesion. Pink lips are normal in light skin, bluish and freckled lips in dark skin clients. The vocal mucosa should be colored pink in light skin clients, and landmarks is something that mark it's smooth and moist with no redness or swelling. Okay. Wearing gloves, retract lips to inspect and palpate gums for color and consistency. Okay. Wearing gloves, inspect and palpate teeth for condition and color. Ask client to open the mouth. Open the mouth, please. The gum should be inspected. Inspection should be upper and lower gums, and they should be symmetrically moist, pinkish, and well-defined margins. For the palpate teeth, normal teeth has 32 pearly white teeth with smooth surfaces. Some have 28 teeth, and if 4 wisdom tooth did not erupt, usually the smokers and coffee drinkers in large quantity, they have yellow and tooth decay appear brown or dots. Next is inspect protruded tongue for symmetry, texture, movement, and color. I'll be asking a patient to stick out her tongue. Stick out her tongue. Okay. For the normal findings, now usually it is pink, moist, moderate size with little. Observe external nose for skin appearance, shape, and nares. Color or the external nose is the same as the rest of the face. The nasal structure is smooth and symmetric, no tenderness or abnormal. Abnormal if the tenderness in palpation indicate infection. Check the patency of the airflow through the nostrils by occluding one nostril at a time and asking client to sniff. Client is able to sniff through each nostrils and other. Check the patency of airflow with the nostril by at a time. Go. Next is inspect internal nose for appearance and landmarks, turbinates, and septum. Use your non-dominant hand to stabilize and gently tilt the client's head. I'll be gently ask the client to tilt or gently tilt. Inspect the anterior nerves. Use a pen or torch if necessary, and the turbinates are inside the nose that can cause nasal obstruction if they're too large. For normal findings, the nasal mucosa is dark, pink, moist, and free to exudate. For the nasal septum, it intact, free from ulcer or perforations. Normally, the septum lies centrally in the nasal passage or symmetrically. Turbinates are dark pink, and turbinate will not visible. Next is palpate external nose for firmness. The nasal structure is smooth and symmetric and no tenderness. Next is palpate sinuses in both frontal and maxillary for tenderness. Palpate the frontal sinuses by using the thumb to press up on the brows on each side of the nose. Palpate the maxillary sinuses by pressing thumb up and maxillary sinuses. First is palpate the frontal sinus by pressing upward just below the eyebrows and note the tenderness. Next is palpate the maxillary sinuses by pressing below eyes and note the tenderness. There is no tenderness. Palpate sinus using thumb to press up. Now, normal frontal and maxillary sinuses are non-tender to palpate and no crepitus or cracking. If the patient has large amount of exudate, you may feel crepitus upon palpation over maxillary sinuses and palpate sinuses both frontal and maxillary for tenderness. Next is percus sinuses for resonance, lightly top or percus over frontal sinuses over the maxillary sinuses for tenderness. Sinuses are tender in clients with allergies or sinus infection. Normally, sinuses are not tender, sensitive, or painful or resort to pressure. Lightly top over the frontal, and that's your sign for tenderness. Normal sinuses give tympanic sound and percussion. Dull sound is heard if the sinuses are largely filled with exudate, and tympanic sounds or drum-like sounds heard over air-filled structure.